Hello, welcome to Adult Education for January 16th, 2022. We are here today entirely virtually again, and we'll continue this in this fashion for a while. And I'm so glad for all of those who have been able to join us and who are here today. And if you're watching this at a later date, I'm glad you're joining us then as well. We have a great opportunity and a great learning opportunity and presentation today, and I'm going to turn it over to Jenny Von Bergen to introduce us.
Good morning. I am pleased to welcome Dr. Kate Walsh today. She's going to join us to talk about sexual trauma and ways to access help in the community. She is a licensed clinical psychologist and a professor of psychology and gender and women's studies at the University of Wisconsin-Madison. Her research focuses on risk factors for and the prevention of sexual violence among adolescents and adults, as well as treatment for mental health and substance use disorders among those who have experienced violence. She has lots of experience in this area, has published articles and book chapters, and I know I am looking forward to hearing her speak. Before we begin, I'd like to just say a prayer. You can take a deep breath. Dear God, as we approach this challenging topic of sexual trauma, let us proceed with grace, compassion, and honesty. Remind us that there is grace in very ungraceful places. Amen.
Excellent. Thank you so much for that introduction. So I want to start off with a similar kind of acknowledgement that both Jeff and Jenny mentioned. The material we're going to be covering today is challenging, and if you or a loved one have ever had an experience like this, it can be especially challenging. It can be challenging even if you haven't. And I want to encourage everyone to do what you need to do to take care of yourself, whether that means stepping away, speaking with my colleague Dana from the Rape Crisis Center, or doing whatever you need to do to make sure that you are taking care of yourself. In terms of an agenda, I want to start by talking about what sexual violence is and who it affects. I'd also like to talk about some of the risk factors, some of the outcomes, and what we can do both as a society and individually. Are you all seeing a red line on a screen down at the bottom? That is new. I'm not sure what that is. Sorry. So many of you have probably seen some media coverage of the Me Too movement, which has really highlighted the ubiquity of experiences of sexual harassment and assault among women and trans folks in our community primarily, although men can certainly be survivors as well. So contact sexual violence, which is how I'm going to describe sexual violence in this talk, is a significant problem in the United States and globally, although I'm going to be focusing just on numbers here in the United States for the purposes of today. So it refers to any unwanted sexual contact, which can be sexual touching, fondling, etc. It also refers to rape, so that includes penetration, oral, anal, or vaginal, and that is typically defined as occurring due to force, so somebody holding you down or forcing you in some way, as well as incapacitation. And this typically means that a person is unable to either give consent or resist, and is often defined as occurring due to the use of substances. So it could be that a person themselves maybe drinks a good amount and is unable to kind of know what they're doing and really can't make a decision about whether to consent, or maybe they're even passed out, so there's no way they could possibly resist. Or it could include a perpetrator giving someone a substance like a date rape drug in order to have sexual contact with them. Sexual coercion is also included in this definition. And so sexual coercion includes any unwanted sexual contact or penetration. But here the tactics are more around either using one's position of power or authority. So for example, in the workplace, if a supervisor were to say something like, well, I'll give you that role or that raise or promotion, but you need to sleep with me. That's an example of sexual coercion. But it could also be just in the context of a relationship, like the continual sort of wearing down of another person's rights to say no, or to say like, I don't want to have this happen. And so really kind of saying things like, well, you would if you loved me, or using lies or other sorts of forms of coercion to convince someone to have sex when they don't want to, or to have sexual contact when they don't want to. And lastly, included here is being made to penetrate someone else. And so this is particularly relevant for boys and men, but also does happen for girls and women as well. So in the United States, we see that about 1 in 2 US women will report some lifetime contact sexual violence. We see that nearly a quarter of US men will report some lifetime contact sexual violence. And then if we look at adolescents, so if we measure in the national population, adolescents who are around 17 years old on average, and we ask them about all of their past lifetime experiences, more than a quarter of adolescent girls will report some exposure to sexual abuse or unwanted sexual contact before they reach age 18, and about 5% of adolescent boys will. So in addition to experiencing, these single forms of sexual violence over the life course, there's also evidence that if you experience early life victimization, you're at greater risk for experiencing what we call re-victimization. So re-victimization refers to typically the association between early life childhood sexual abuse and that putting one at increased risk for experiencing sexual assault later in adulthood. And across many, many, many studies, we've seen that about 1 in 2 child sexual abuse victims will go on to experience adult sexual assault. When we don't separate things in that way, because we're arbitrarily kind of drawing a line at 18 and saying, well, above 18, there is, we're calling you adults, and below 18, we're calling you children. If we actually think about certain developmental periods as having, the potential for there to be repeat victimization during those periods, we see an even higher prevalence. And so over on the right-hand side, I am showing some data from 3 different samples of folks who we recruited at a national level. And so we used random digit dialing methods, meaning we called up people's households. And if they had someone in that household who met our gender and age criteria, then we did a telephone interview with them. And so we collected data from adolescent girls. So they were between the ages of 12 and 17, college women, so typically 18 to 22, and then adult household residing women. And so they could be any age up until 65, so 18 to 65. And so what you're seeing here is the top of the blue line shows you the percentage of people in each of these samples who'd experienced any rape. And remember, that's a really narrow definition that includes penetration and force or incapacitation. And so we saw about 11% of adolescent girls had experienced a rape, about 11.5% of college women had experienced a rape, and about 20% of adult community residing women had experienced a rape. However, the red line that you're seeing here, so the top of the red bar, shows the percentage of those who'd experienced a rape who'd been raped 2 or more times in their lifetime. And so what was really striking to me is that these adolescent girls, who were on average around 14 and a half years old, had about 52.7% of them had already been raped 2 or more times. And we saw similar percentages in each of the samples. And so this repeat victimization is a significant issue and something that we need to think about. I think oftentimes in like the legal system, for example, we think, well, if you've had it happen once, you would know all the risk factors, and so it wouldn't happen to you again. You'd be less likely to have it happen. And so this idea that re-victimization is a real thing, and it's something that just because somebody's had it happen before does not mean that they're not telling the truth in this instance, is something that I see we often have to kind of do a lot of education around with folks in the legal system. So as we were just talking about, we've seen that women and young folks have an elevated risk for experiencing sexual violence. And in fact, young people are at significant risk. But I don't want to discount the idea that sexual violence can happen at any point over the life course. And so 80% of first assaults are typically occurring somewhere between the ages of 18, like right around the age of 18, but they can go up through 25. And then we see people being re-victimized over the life course as well. And certainly a first assault could happen after 18 or after 25. We also see that women, trans folks, those who identify as genderqueer, non-binary, two-spirit, or pangender are at increased risk for sexual violence. We see that folks who identify as lesbian, gay, bisexual, or queer are at increased risk. We see that people of color, particularly multiracial and American Indian women, are at especially elevated risk. Nearly 1 in 2 multiracial and American Indian women have experienced a rape. And if you broaden it out to the other forms of contact sexual violence, the rates are even greater. We also see that experiencing economic or housing insecurity can be associated with risk for sexual violence. And this makes sense because if you don't have resources and like a safe place to stay, you're at increased risk for having someone victimize you. And then we also see that disabled folks are at elevated risk. So one of the things I'd like to talk a bit about is essentially how different beliefs in our society contribute to the ways that we see sexual violence and the ways that survivors themselves may see sexual violence. And so in my world, we have this idea of rape script theory. And this is essentially the idea that real rapes look a certain way. Real rapes are often depicted in the media and in movies and in shows as a stranger jumping out of a bush and they have a weapon. And in reality, the perpetrator is typically known to the victim. So in about 80 to 90% of cases, we see that most people know their assaulter, and force is used in less than 50% of rapes. And so coercion and incapacitation are also quite commonly used. And it's not like people just use one tactic either. And so there may also be many things going on in a single assault. And what this means for society and for survivors themselves is that many people don't acknowledge something that actually meets criteria for rape or sexual assault as a rape or a sexual assault. And there may be important reasons not to acknowledge, which I'll talk about in just a minute. But in fact, when we survey folks and we ask them very behaviorally specific questions, we might say something like, has anyone ever put their penis in your vagina when you didn't want them to because you were unable to consent due to the use of alcohol? You were so impaired that you couldn't consent or resist. And we'll see people check off that. And then when we say, have you ever been raped or sexually assaulted? About 60% of the people who might check off one of those behaviors will say, no, I've never been raped or sexually assaulted. And so that's pretty significant. The majority of people who've experienced what meets behavioral criteria for a rape or sexual assault don't acknowledge it that way. There are definitely some benefits to not acknowledging. So we do see lower mental health symptoms, we see lower PTSD and depression among those who don't acknowledge. So they don't think of themselves as a victim, and therefore they may not be developing the same kinds of sequelae. However, there are some significant drawbacks. Typically, folks who don't acknowledge have greater acceptance of rape myths, or this idea that the people who experience assault are responsible for their assaults in some way. They also tend to blame themselves more as a result. They're less likely to seek medical attention. So in some of the work that I've done, we've compared women who've experienced forcible assaults to those who've experienced drug or alcohol facilitated assaults. They have very similar medical concerns. So they're both worried about HIV, they're both worried about STIs, they're both worried about pregnancy, but because the people who experience the substance-related assaults are less likely to label it that way because it doesn't fit rape script theory, they don't know they're eligible to go to the hospital and get services and get these things tested. And so they're less likely to seek those services. We also see a higher likelihood of being re-victimized over the life course. So if you don't acknowledge what happened to you as a rape or a sexual assault, you'll check it off on a form, but you say, no, I've never been assaulted, then you are more likely to have it happen again over the life course. And so some of our thinking around this is that this idea of rape script theory also fits with some other societal beliefs that we all hold to help ourselves feel safe. And so essentially we've developed this belief that we live in a just world, right? And so this helps us feel confident and safe as we go about our daily activities. The idea here is that bad things don't happen to good people. And so if something bad happened to you and you're a good person, then you must have done something to bring it on. And so this is where a lot of the questions around like, well, what were you wearing at the time? Or were you drinking come from? So I think that they are, really well-intentioned, but are coming from a place of us wanting to preserve this idea that we live in a safe world. So in addition to those societal beliefs, I'd like to talk a little bit more about some of the risk factors for sexual violence and thinking about this from an ecological perspective. So we've talked a little bit about some of the individual factors that might be related to increased risk for sexual violence. So racial and ethnic identity, gender identity, age, sexual orientation. I also spoke about this link between early sexual abuse and later sexual abuse or repeat victimization. And so there have been several studies looking at how one's mental health symptoms might increase the likelihood of being victimized. So let's say you experience an early abuse, you develop PTSD or dissociation, a perpetrator might see you as more vulnerable or less likely to be believed if you were to report it and be more likely to target you. We also talked about adverse childhood experiences as being a risk factor, and we talked about alcohol and drug use. And so alcohol and drug use can cause incapacitation, make it difficult to be able to consent, et cetera. At the next level, so thinking about the relationship level, this is where things like one's family environment and where their dating and sexual relationships start to come into play. And so a family environment risk factor might include early child sexual abuse might be happening in a family where one of the family members is actually perpetrating the abuse, or there might be so much chaos kind of happening in the family environment that it's really difficult to identify when abuse is happening to one of the kids and it just continues for a long time. And so certainly elements of the family environment can make things difficult. We also see that as young people start to transition into dating and sexual relationships, if you're coming from a family environment where you really haven't talked about what dating and sexual relationships look like, that can make it really difficult for young people to kind of navigate those sorts of conversations about like, what are we going to do and how are we going to do it, and have those like healthy relationship dynamics play out. Additionally, social support is a significant factor here. So if you don't have people that you can go to, friends, family members, et cetera, and talk about things that you're worried about, including, something feels a little off in my relationship, that can be a significant risk factor. And then once you've experienced sexual violence, we also see that having social support is really, really critical for the recovery process. At the next level out, so thinking about community, we see that community attitudes towards sexual assault and sexual health can play an important role. And so if a community doesn't invest a lot of resources and it doesn't have different places that people can go to get different needs met, that can really send a message to survivors that like, I'm really alone in this, and I'm not really sure how I'm going to respond to this. Additionally, community support for things like sex education, for having conversations like the one we're having right now, can be really, really important. And so being open to discussions and really thinking about ways to make our communities safer and more cohesive and more connected can be really important for preventing sexual assault. And in communities where there isn't that, there's a greater risk. And then at the outermost level, thinking about societal factors is really important. And so economic and social policies are critical. If we're not putting money into resources and we're not thinking about like how social policies might positively or negatively impact folks, that can play a big role. We also see the social acceptance of violence against women play out in lots of different ways. And so this is important to think about. And then police and judicial system actions can also play a role. There was a case from early last year in Minnesota where a jury had convicted a rapist, and the judge overturned the rape conviction because the survivor was voluntarily consuming drugs and alcohol when the rape happened. And so really sending the message that like, if you are drinking or using drugs, we think it's your fault and we're not going to hold other people accountable for their terrible actions. And so things like that can really send the message to community members and to survivors that like, we don't care about what happens to you and we're fully supportive of these things happening. And so just so everyone's not all up in arms, the loophole in that law was changed as a result of this case, but I do think that it's important to acknowledge that those kinds of things do have a lasting impact on folks. So I also want to talk a bit about disclosure and reporting. So there is this idea with the real rapes, so rape script idea that if it is a real rape, you're of course going to report it to the police because why wouldn't you, right? And we do see that the majority of survivors tell someone, typically a family member, a friend, a religious leader, or some other trusted person. Not all of the responses that they get are helpful, even if they are sometimes well-intentioned. So sometimes, and I'll talk a little bit about helpful responses and unhelpful responses, but sometimes somebody might be trying to understand, or they might be just really surprised and like, are you sure this happened? And that can really feel very invalidating to survivors when they disclose. But fewer than 1 in 5 survivors actually report to police or authorities. And I think that this is not something that the general public is always super aware of. And so this idea that like, well, if it really happened, you would of course tell police because it's a crime. And like, why wouldn't you report a crime? There are a lot of reasons people don't report to the police. Even in cases where these 1 in 5 cases are reported to the police, it's very rare that the cases actually go to trial. A lot of times, prosecutors are worried about he said, she said stuff, and they don't even take it to trial. They might plea it out if they can do anything along those lines. And so it's very, very rare for anyone to actually serve time for committing an offense. It's also a very long process for survivors. In some cases, they have to wait to start treatment until after they've done the forensic interviews, which can take a really long time. And so you're delaying your like recovery and healing process. And so there are just so many reasons why survivors choose not to report. And so I just think it's important for everyone to know that it's rare to report. And what this means is that oftentimes survivors are not getting connected to important medical, mental health, and other support services. So only about a third of survivors see any immediate medical, victim advocacy, or police assistance. And so that means that about 2/3 are not getting connected to these other important resources. So I want to briefly speak about the outcomes of sexual violence. I'm a licensed clinical psychologist, and so I've done a lot of work in a lot of different settings, including, at the VA with military sexual trauma. I've worked with adolescents and children. I've worked with adult women. I've worked in prisons. And across all of these different settings, one thing that has really stood out is that there is no single presentation that somebody who's experienced sexual violence comes in with. So I can't hear a list of concerns and be like, oh, you must have experienced sexual violence. It's really very varied. And so some of the things I see are certainly mental health. And so post-traumatic stress disorder, or PTSD, is a very common concern for some of the folks who end up in my office. PTSD is often associated with combat trauma. However, rape is the single trauma that is most likely to lead to a diagnosis of PTSD. And PTSD includes things like having unwanted recollections or dreams or flashbacks about a traumatic experience. It also includes avoidance of people, places, and things that remind you of the experience. It includes developing kind of negative cognitions and feelings about yourself and about the world around you as a result of your experience. And it can include kind of some heightened physiological symptoms. So things like being irritable, angry, jumpy, or what we call hypervigilant, engaging in some risk behaviors, etc. Depression often co-occurs with PTSD. And so this might include feeling sad or blue most of the time, feeling worthless, hopeless. It can also include some somatic symptoms like gaining significant amounts of weight, or eating a lot more, or sleeping a lot more, or conversely losing a lot of weight, not sleeping enough, etc. Those things don't necessarily coincide with each other, but just they can be different ends of the same kinds of spectrums there. And then anxiety symptoms. So this could be anxiety about, not wanting to go outside of your house, or what we call agoraphobia. It could also be anxiety about like what people are going to think of you if they find out that you experienced a sexual assault. Are they going to blame you? Or are they going to think it was your fault, etc. Or it could be generalized kind of anxiety and worry about what might go on. We also see high rates of suicidal ideation and attempts among people who've experienced sexual violence. In terms of behaviors, I often will see people who start self-medicating after experiencing trauma. So they might use substances to help themselves sort of forget about the trauma in the immediate moment. However, and while it does help in that immediate moment, it can put them at risk for developing a substance use disorder over time, or for potentially experiencing re-victimization or repeat victimization if they use to the point of passing out or blacking out or being unable to like consent to sexual activity. We also see folks engaging in risky sexual behavior. This might include having a large number of like uncommitted sexual partners, or sex trading or other kinds of behaviors. And some of the thinking behind the risky sexual behavior is essentially that people might be looking for a way to connect with folks, but feel really uncomfortable with risking the vulnerability of like a more intense emotional relationship. And so they want the pleasure and the connection, but they don't want that vulnerability of having to be in a longer term kind of relationship. And so they may jump from partner to partner. And while this might serve their short-term needs, over the long term, it puts them in contact with more people, some of whom may be sexually aggressive. And so that's where we find that to be problematic. And then self-harm behaviors are also not uncommon. So cutting and other kinds of things are not uncommon among people who are trying to regulate the dysregulation that comes out as a result of experiencing sexual violence. And then lastly, and related to some of the pieces above, it's not uncommon to see folks who are really struggling with trust and intimacy and other kinds of issues in their intimate relationships. I also see it kind of coming out with family relationships at times too. So let's say a survivor did tell a family member and the family member didn't believe them or didn't respond well, then there could be some difficulties in that relationship as well. So about 8% of those who are exposed to any kind of trauma, so this might include combat trauma, motor vehicle accidents, et cetera, develop PTSD. However, sexual violence is associated with elevated risk for PTSD. Using those same 3 samples that I showed up above, where we looked at single versus repeat victimization, I've got these same 3 samples on this slide as well, and we looked at the percent who met criteria for a PTSD diagnosis. Those who had a single rape are in blue, and those who were raped 2 or more times are in red. And so I think a few really striking things. You can see that we're well above 8%, even for past 6-month meeting criteria for PTSD. But in the re-victimized college student sample, nearly 60% met lifetime criteria for PTSD. And so this was really, really striking to me. And so I think it just highlights the potential for sexual violence to cause significant and impairing concerns for folks. I also am presenting here just some of the substance use data, and this is just for the adult community women. The other 2 samples look very similar, but I just couldn't squeeze them all into one slide, so I picked one to show you. And this is essentially looking at people who have not experienced victimization, those who've had a single rape, and those who've been raped 2 or more times. And what you can see here is essentially a stepped pattern of use according to like the severity of their victimization experiences. So people who've experienced 2 or more are more likely than the other groups to be using substances at a higher rate. And I should just say non-medical prescription drug use refers to like any use of like prescription medications that are not as a doctor prescribed or that weren't prescribed for you. And so we've been seeing a big uptick in like opioid use, for example, et cetera. And so we've started to measure this pretty carefully as we're measuring illicit drugs. Okay, so what can we as a society do to prevent and respond to sexual violence? I think one of the first things is having conversations like the one that we're having and being really open to learning opportunities. And so I think that there are very few spaces in our society where it's okay for people to have really open discussions about sex. Our country was founded on kind of Puritan beliefs. And so we often are not as open if you compare us to other countries in terms of how we even discuss sex or things like consent or healthy relationships. And in fact, some of our sex education programming for youth are basically showing people what the body parts for the different genders look like, and making sure that people are aware that they could get pregnant or they could get an STI or HIV, and kind of leaving it at that. So kind of instilling a little bit of fear. And I think it would be nice if some of that programming could be expanded to really talk about like, how do you have a healthy relationship and what does healthy communication look like? And how do you negotiate consent? And so when we aren't providing our youth with like any guidance in that way, they are turning to pornography, which can be really wonderful. But they're turning to pornography to learn like, how does one have sex and how do you go about doing this? And to my knowledge, you have to look pretty hard to find a good pornography genre that really depicts consent in a good way. What I've seen is mostly like a pizza delivery person shows up and all of a sudden you're having sex with this person and there was zero conversation about it. And so I think it's important that we start having more conversations so that our youth are not going to pornography to learn about consent. I also have a colleague who likens our current approaches to sexual education to like, imagine if we taught people how to drive by showing them where the carburetor is and telling them a little bit about how that works. And we don't talk to them at all about stop signs or like how to turn on your signals in your car or anything along those lines. That's kind of what we're doing right now. And so it's not surprising that it's a bit of a mess. In addition to having these conversations and learning opportunities, I also think that there are opportunities for each of us to be just more aware of what healthy and unhealthy dynamics might look like. And if you hear a friend talking to their partner in a way where you're like, wow, that really seems like not what I would have expected, I think it's important to have those conversations about, is everything okay? And trying to really better understand sort of how things are going and make sure that they know that there are resources if they do want to try to work things out in different ways. There are also some direct actions that we can take when we are in situations where maybe we don't know exactly how to respond or what to do, but it seems like something is happening that shouldn't be. If you are in a situation like that, there are 4 Ds of bystander intervention that you can use to try to deflect or de-escalate the situation, if you will. So one would be to direct, where you might be getting help because you're not exactly sure what to do. So you seek out someone who's in a help-seeking role who could really step in and intervene. So like in a school, this might be like, finding someone in the school, a teacher or a principal or someone in a position of authority who can kind of step in. You could also distract. So you can do things like, if you see somebody speaking to someone else in a way that's not appropriate or trying to corner them or something like that, you could be like, can I talk to you for just a minute? And act like you know them and kind of get them away from the person. So, get in there. You can also do some delegation where you can really try to be kind of calling the person out or calling them in, hopefully, but, trying to get them to recognize like, hey, I see what you're doing, this isn't okay, and get them to get out of that space. And then you can also delay. And so this might mean, trying to make sure that you stay in the situation and that you're there and present as long as you possibly can to make sure that the person is okay. And then you could report afterwards if the person wants to, et cetera, and that kind of thing. And then at the broadest level, I think that we could do a better job of investing in community resources. We have someone from the Rape Crisis Center here today. Our city has recently defunded, or I shouldn't say defunded, it's not a complete defunding, but we have cut resources to some of the programs that I'm going to be telling you about in just a minute, including the Rape Crisis Center. And so as much as we can advocate for the city to like fully fund these spaces, I think that's critically important. We can all donate as private citizens to keep our community partners running. And then I think voting for leaders who will prioritize funding for these agencies in their budgets is really, really important as well. All right, I wanted to speak briefly about what to do when someone discloses to you, so kind of do's and don'ts. And then I'll show the resources and then we can get into some questions and answers. So a lot of these are probably going to seem very obvious to you, but I do get some questions about this. So do's, believe them first off, right? So no, like, are you sure that's what happened, et cetera, like believe them. Helpful comments and questions in this situation might be like, I'm so sorry that happened. Do you want to talk more about it? I would avoid asking a lot of detailed follow-up questions because they may be well-intentioned, but again, they can come off as like, oh, you think that I did something to bring this on. So I have some of the don'ts are like asking questions that might seem innocuous to you, but could make them feel like you think that they did something. Let them know there are resources. I'm going to tell you a little bit about what those are. Options, so they don't have to do all of the things that are available to them. They can pick and choose. And one of the important things about working with survivors is like they had their choice taken away when they were assaulted and when the trauma happened. And so when I work with survivors, it's always so important that like their choices and their ability to have agency in their treatment and how we're going to work going forward is upheld. And then also let them know that there are people who want to support them in various ways in the community. And so it's really about what they want. This isn't true for people who are under 18, unfortunately. So mandatory police reporting happens for those who are under 18. And so I think that's important to note, but there are people who want to support them, even if mandatory police reporting has to happen. Don't. So try not to dismiss their concerns or ask if they're sure. Avoid asking questions like, were you drinking and what were you wearing? And things that could potentially make them feel like they did something to bring this on. All right, so some of the resources that are available in our community are Rape Crisis Center, where Dana is from. And so they provide medical and legal advocacy. Advocacy means that they can be present with a survivor and follow them through their whole recovery process, help to explain options, support them in their choices, provide emotional support. They can also connect them to other resources. They can help them fill out these like lengthy and difficult to navigate crime victim compensation applications and do some safety planning. They also recently began offering counseling, which is an awesome opportunity for our community to be able to get better access to mental health counseling for survivors of violence. There's also domestic abuse intervention services. And so this might be a better space for folks who are experiencing more physical partner violence. But certainly sexual violence happens in the context of physical partner violence as well. But they can provide legal advocacy. They do a lot of helping to obtain restraining and protection orders. They offer support groups. They can also offer shelter if someone is looking to get out of a relationship and needs a space to go. They can offer emotional support, and then they can also do resources and referrals. There is a center for children here in Madison called Safe Harbor Child Advocacy Center. They're really wonderful. They do a great job of trauma-informed care. They provide a safe environment for forensic interviews. So that's where police would come in to interview the child. And then they can also provide ongoing case-based advocacy. And so this is a center for children and adults who have intellectual disabilities. And then there's the Meritor Forensic Nurse Examiner program. This program will see children, adolescents, adults, adults with intellectual disabilities, et cetera. They will see folks who've experienced sexual violence. They will also see folks who've experienced physical partner violence. They do a really good job of assessing for like strangulation and other sorts of like physical health problems. So they can assess and treat injuries, provide emotional support and safety planning and follow-up planning. They can also do pregnancy, STI, and HIV prophylaxis assessment and treatment. They can test for substance facilitated assaults. Like if someone is given GHB, they can test and see if that's in their system. And then they're trained to collect evidence. So if somebody does want to report their assault to police and they want to follow through, the nurses can get the evidence at that time. People do not have to decide that they want to report to have an exam though. So you can say, I don't know if I want to report. I do want you to collect evidence, but right now I don't want to report. And if I change my mind, then they can get in touch with the state crime lab within 10 years, because that's the statute of limitations, and decide, hey, I want that evidence that was collected to be included in the case that I'm now pursuing. Okay, I think that's everything that I wanted to cover. I'm going to stop sharing so that I can see folks. And if you have any questions, I'm happy to start answering them.
So I'll be scanning for questions, and I'll be keeping my eye on the participant list. If anybody has any questions and would like to do a visual hand raise, I will keep an eye out for that. My one question I have is about mandated reporting. You brought that up, and I think it's worth knowing the who, how, and why. So who is a mandated reporter? How does that work? I guess the why is obvious, but the who, the how, and when does that trigger?
Yeah. So medical and mental health professionals are mandated reporters. So, and I think some school professionals are also considered mandated reporters because they're coming into contact with children. And essentially the idea is that if you see something that feels off, and you suspect that a child might be either neglected or abused, or if you see that like an elderly person, or you learn that an elderly person is being mistreated, or someone with intellectual disabilities, then it is required that you make a report. So if you have knowledge or awareness of this, then you would need to make a report to the our Department of Health and Human Services, and then they make a determination about whether or not they're going to investigate. And then oftentimes places like the Child Advocacy Center, for example, would get pulled into cases where they are investigating and they're actually going forward and charging someone in those cases. So does that help?
Yeah, absolutely. And I very crucially, I want to make sure people know, if you have a question, but you do not feel like you would like to ask it, please send it privately to myself or Jenny in the chat, and we will ask it anonymously. And I just want to make sure that people know that there's that option available. I'm looking around for additional questions. Charlie, yeah, I see you. You can unmute yourself.
Thanks for being here, Kate. In my preparation for this, I've done a lot of reading, a lot of conversations with people, and you mentioned pornography in here.
Yeah.
I've found a fairly broad spectrum within the church and beyond the church about the opinions of pornography. And I think you said it can be wonderful, but there's a lot of problems with it. I'm just wondering if you could say more about that. Talking to people in the congregation, if my wife and I watch an R-rated movie where there's a love scene, some people would look at that and say that they're naked, that's pornography. And I'm like, and obviously there's a whole spectrum going well beyond that.
Sure.
There are people in this congregation who've been negatively impacted by pornography, and they've told me it's all bad. There's no just, and
yeah.
But I also hear from people whose opinions I respect, and they have a different opinion. So I'm curious if you could say more about it.
Yeah, absolutely. So I will caveat this. I'm not a pornography expert. It does come into my spaces where I do research in different ways, but certainly there are people far expert than I. So I think that I've done a lot of couples therapy, which I love doing. And I have definitely encountered couples where it can be a really wonderful, healthy part of their sex life. So they share pornography and have found like a genre or, something about it that really appeals to them. And it can be a really healthy thing for them. There are also situations where, even in couples therapy, like one person may be more attracted to the pornography, and it may actually detract from like the interpersonal connection and how often you're actually engaging in sex with your partner. And so I've certainly worked with couples where we've had to kind of work out the okay, are you moving into a space where like you are prioritizing the pornography over like the actual like interpersonal connection that you have with your partner. And so there are certainly cases like that where it can be a little bit more challenging. From my perspective, I think there are certain genres of pornography that like violent pornography that can be really, thanks for sharing that. Dana said there's also ethical pornography that can be found online that elevates consent and fair pay and trade practices. Yes, and if we could direct our youth to that kind of pornography, I would be so much happier with the idea that youth are looking for information about sex through pornography. I just think that oftentimes people don't even know what they're looking for, and so wouldn't even know to search ethical pornography necessarily. Where I think it can be problematic is in some of the more violent depictions of pornography. Like we see more frequent use or watching of violent pornography being more related to risk for perpetrating sexual violence. And it makes sense, right? The idea that you might become desensitized to seeing violence in the material that you're watching might make it so that when you are engaging in relations with other people in your real life, you're kind of desensitized to violence, and you may think violence is a really normal part of sex. And I think you start to kind of conflate violence and sex in some ways, which I think is concerning. And then, of course, there's a whole world of sexual exploitation that is based in pornography. And so like sex trafficking and sexual exploitation of minors and things like that, that piece of pornography I do find really concerning. And I think, if there's not a market out there for it, people aren't going to be exploiting others to make it, but because there's a market for it, it can be a definite risk factor for bad things happening to people in our society. So, so pros and cons, if you will.
Thank you for that response and enlightening perspective. I'm looking at the time and I'm recognizing where we are, and I'm planning on closing us in prayer shortly. But if there is one more question, I'll look briefly around and see if somebody has something in particular that they are. Yeah, Chelsea, I see you there.
Yeah, I just have a follow-up question. Thank you so much for offering this morning. I guess my question is really for the, on behalf of really the percentage of people who have not reported their experiences, who have been the ones who told the trusted friend, family member, partner of something that happened a long time ago, or, for the majority of us, right? And I would say there's probably many of us on this call who fall into that category. Can you speak a little bit to just, how to be a supportive partner, spouse, friend, parent to those those people, right? All of the people who, have not gone through any kind of formal processing or legal process with this, but hold this experience and hold it forever. And, what does it look like to kind of be good listeners, good partners, short-term and long-term, when that's really kind of the story that we hold and there's no other kind of process to do with it? I'm just kind of curious about your perspective on that.
Yeah, I think that's a really wonderful question. And we could probably spend a good amount of time talking about what that might look like. I do think that this is another space where creating relationships and dynamics where there are very open lines of communication and where there's a lot of trust is really critical. And, finding those people, if you are a survivor who maybe hasn't disclosed to anyone before, but it's something that you've carried with you for a long time, finding someone who you can talk to, who you can trust. You can start with places like the Rape Crisis Center. So they don't require that it has to have been something that happened immediately. And if you want to process, that's a really great place to start. But then I think also thinking about your interpersonal relationships and your connections to folks, and what are you comfortable disclosing to them, and how do you anticipate they're going to respond? And then, if they don't respond in the way that you expect, are you comfortable talking with them about that? Because I don't think most people who respond poorly intend to respond poorly. I think and I think a lot of us are probably now anxious about, oh my gosh, if somebody tells me about this, am I going to respond properly? And I think it's really about being a good, as you put it, a good listener, not asking a lot of invasive questions, but letting the person just talk, empathizing with them, saying I'm really sorry that happened. And also maybe giving them space and understanding when something might be too much for them and they need to back off of it. And there could be reminders that you don't even know about that come up for them that it's important to kind of be thinking about, maybe this person's responding in this way because of that experience that they told me about. Maybe not, they could be totally unrelated, so you don't want to make assumptions, but being kind and gentle and compassionate, I think, in your approach with them, if that makes sense. Thank you for sharing, by the way. I appreciate that.
Yeah, thank you. Ernie, I did see that your hand was up, Ernie Madison. If this is a quick question, we can do this. I'll have to ask you to unmute though, because you are muted. But I'm unable to hear you. Oh, there you go.
Right. Who was asking the last question? I didn't see anybody talking.
It was Chelsea. Chelsea Cornelius asked the last question. Yes.
Uh-huh. Oh, I see. So she's not shown, or I don't see her on there. Anyway, I'm a retired professor from the university, and some grants that I had came from a local company, and they recently widowed head of the company, who became the president of the company when her husband died, pressured me to become her sexual partner. And I refused. I've been faithful to my wife all of our married life. And but I was curious regarding, suppose I had consented to that, what would be my fate?
Well, thank you for sharing that experience. It's interesting. Not everybody responds in the same way. And so I think that there are a lot of different kinds of ways people could respond. So there's no one single fate. I do think that it's more difficult for men to come forward about experiences that they may have had. And so we saw, nearly a quarter of men have had some unwanted contact sexual violence. But I think it can be really challenging to one's ideas of what it means to be masculine in our society, et cetera. I also think that men don't perceive the spaces that we've created for survivors as being spaces for men. They see them as being spaces for women or for trans folks. And so I think it can be really, really difficult for men to come forward and get help when they do need it. But as to your question, I don't have a magic ball, and so I can't quite predict exactly what would happen. But it sounds like if you were in a situation where you reluctantly consented, that you may not feel great about it, and so it could express itself in a wide variety of different kinds of ways. So I know it depends, and not a very clear response. But like I said before, survivors present in so many different ways, and it's not all. There's no one single presentation that I see that clues me in that someone might have experienced violence.
Thank you. Thank you very much. And thank you everybody for being here. This was important, obviously, so important. And I'm so thrilled, Kate, that you were able to be here to share this with us. And the conversation doesn't end here. Conversation continues, and there are resources available, obviously, and you can feel free to reach out to myself or Charlie or Melissa or anyone else you trust, and we can work on connecting you with resources and being there in whatever way we can. It's important to us, and you're important to us. So please know that we are here to care and be present. And now as we go, I'd like to just close us with prayer. Gracious God, we are here as your people. We know that you call us to love one another. And we ask that we may do so responsibly, that we may honor the whole person, and that we may learn evermore how to respond to one another. We ask that you walk with survivors and those who are recovering or suffering or walking through this journey, that you be with them, that your spirit be present among them, encouraging them, giving them strength, helping them to find those who personify your love. May we regard each other with love and honor. May we do all that we can to be kind and gracious. And that may justice be how we live our lives, and may justice be the end that we all seek together. Amen. All right, thank you, everybody. Thank you, Kate. Thank you, Dana. Thank you those who are here and those who ask questions. And we'll see you. If you do need to be, if you do want to say more, there is the sermon talk back at noon, and you're more than welcome to join us then as well. All right, take care, everybody. Bye.